dynamic stabilization of the glenohumeral joint. What is dynamic stabilization means? Suppose when we are doing a movement in the shoulder joint, that time shoulder should be stable in the position. That means the articulation between glenoid fossa and head of the humerus should be stable in their anatomical position. That is dynamic stabilization. These dynamic stabilization will be provided by the muscles. Now we'll see which muscles are going to helpful in the dynamic stabilization. First one, deltoid. Second one, rotator cuff muscles. In this two, first one supraspinatus, specially it will help. After that infraspinatus, then teres minor, then subscapularis. After that last one, long head of biceps brachii muscle. So all these structures are going to, all these muscles are going to helpful for the dynamic stabilization of the shoulder joint. We will see one by one. We will go in very simple manner. For example, if we take one force, according to force components, here we can draw two force components for this force. One force will be translatory force, one force will be rotatory force if the force is there. So remember this point, then we can come here. First one deltoid. If we take deltoid is a big muscle. It is a combination of the anterior fibers, medial fibers and posterior fibers. Suppose if we take the shoulder joint, this is our shoulder joint. Suppose the deltoid muscle will be like, see, anterior fibers, middle fibers, posterior fibers. So like this we can see the deltoid. This is the insertion of the deltoid. It is a big muscle, and it is a multi-pennate muscle. So what is the point, how it will help in the shoulder stabilization? So here I am taking this is scapula. So here we are taking the head of the humerus. This is our scapula. So if we take like this, the action, see, insertion point of the deltoid will be here. The deltoid muscle insertion will be here, as we saw here. So the action line, even though deltoid muscle is having anterior portion, middle portion and posterior portion. Anterior portion will be having one force and posterior portion will be having one, and middle and posterior. So together we can say that the middle portion, we can show the action force of the deltoid muscle through the middle. So it will be somehow like this. This is the action of the deltoid. So if we draw the force components, so see here, this is one force component and here one more force component. This is Fx, this is Fy. So these are the force components. This force component is nothing but the translatory, it is nothing but the rotatory component. So if you observe clearly here, the length, the magnitude of the translatory component is more than the rotatory component. So here the deltoid muscle has to create the rotation. That is what dynamic means. Movement should happen inside the joint. So here when the deltoid is creating the rotation, stability should be happen inside the joint. But here, see here, rotatory component magnitude is less compared to the translatory component when the deltoid muscle is acting. What it means, here the rotation force is less, translatory force is more. Because of this, what will happen, the humerus head which is present here, it will translate superiorly more because translatory force is more. So here what is the point means, it will create rotation, it is there, but still translatory force is more, so that it is going to move the head of the humerus superiorly more. So it is not going to provide exact stability here, even though it is producing mobility. If it is not providing exact stability, then how the shoulder is maintaining in stability when it is doing dynamic, when it is doing movements? If the deltoid is not working properly, how the shoulder joint is maintaining in stability means because of the itis muscle, infraspinatus, subscapularis and teres minor muscle. Because of these muscles, now we'll see those muscles. So here second point, itis muscles, infraspinatus, teres minor and subscapularis. Suppose if we see the scapula posteriorly, so this is our scapula, this is spine of scapula, this is supraspinous fossa, this is infraspinous fossa. This is infraspinous fossa. From here, which muscle will come? Infraspinatus muscle will come. So from here, which muscle will come? From here, we will get teres minor muscle. Teres minor muscle. This is posterior view. This is posterior view. If we see anteriorly scapula, so here there is no spine of the scapula anteriorly. So anteriorly completely one muscle will come, that is subscapular. So the combination of infraspinatus, teres minor and subscapularis. These three muscles we will see here. Itis means those three muscles. Suppose if we take the action, now we are drawing this is our shoulder joint. This is our shoulder joint. So action of these itis muscles, infraspinatus, teres minor and subscapularis, will be, see, the action will be in this direction. Action will be in this direction. These three muscles insertion will be here. So from the head of the humerus, these three muscles will come from scapula and it will insert here. From here, action line will be like this. So if we draw force components, it will be in this direction. Force components will be in this direction. So see here, this is rotatory component, this is translatory component. So now if we observe here, so in deltoid muscle, here rotatory component is small, but if you see here rotatory component is large. So what's the point here? I am saying here fx component is there, translatory component is there, upward direction. So because of the action of the itis muscles, this superior translatory force will be balanced by the inferior translatory force of the itis muscles, so that here there is no superior translation will happen, because itis muscles are coming to action, which are coming to balance the superior translatory force of the deltoid muscle, so that here the deltoid muscle can work pure rotation without causing any translation. Clear? Now if we come to this point here, itis muscle, see here translatory force is there, so it can create movement, it can create translation movement. Which translation? It can create translation. Suppose if you see here, if it creates, suppose if there is no itis muscle contribution here, if it create translation here, humerus will go upward. It is not good for the shoulder joint, so that it will dislocate. So that here this itis muscle action is coming, it will be balanced by the translatory component of the itis muscle here, so that here there is no translation. Leave it. Now if we come here one movement is happening. What happening? Because of this force, the head of the humerus is pulling inside the scapula. So what it means? Even though it is creating rotation movement, at the same time, while pulling the head of the humerus towards the glenoid cavity, it is providing stability. Nothing but dynamic stability. So that's how rotator cuff mean in this itis muscles and deltoid muscle together will work, and they are going to provide both rotation and stability. This is nothing but the dynamic stabilization. Movement will happen, at the same time stability will be provided to the joint. And next we'll come to the supraspinatus. Supraspinatus is a part of the rotator cuff muscle. Now if we see supraspinatus, so if we take supraspinatus, this is the head of the humerus. Here we'll be having the scapula. This is anterior view. So here from posteriorly, suppose imagine posteriorly we are having the spine of the scapula. So this is our supraspinous fossa. If we see posteriorly, so from here supraspinatus muscle will come, it will insert over the greater tuberosity of the humerus. So if we see the action line, this is our scapula, this is our head of the humerus. If we see the action line of the supraspinatus muscle, the force it will be in this direction. The direction of the force will be, supraspinatus will be like this. So if we draw force components, here one rotatory force will come, here one translatory force will come. Here also same like deltoid. So when deltoid got more, see this is our deltoid. So here it is our translatory component, this is our rotatory component, this is our rotatory for deltoid muscle. And if we see itis muscles, these muscles, so here force direction was like this. So this is our rotatory component, this is our translatory component. Here I said like this translatory upward translatory force will be cancelled by the downward translatory force by the itis muscle, so that here this rotation will can create rotation force, it means abduction in the shoulder joint, and this rotation can create movement in the shoulder joint that we discussed. So if we see supraspinatus, so if we see supraspinatus, the direction of force was in this direction. So here the rotatory component is big, rotatory component is large, so it will create rotation. Okay, shoulder, it will create rotation. What about this? Here it is creating superior translation. Here it is creating superior translation. Some other force should act to cancel this translation force. To cancel this translation force, so which force will act? The force will be provided by the gravity. The force will be provided by the gravity. So here this force will cancel each other, and resultant will be 0. So that there is no translation will happen in this when the supraspinatus muscle is acting. So here rotation will be provided to the shoulder joint. Rotation is provided, there is no translation. That's it. Rotation is provided, there is no translation, nothing but stability. So here when the supraspinatus muscle is acting, it is going to create rotation. At the same time, stability will be provided to the shoulder joint by the action of the gravity. This gravity is going to cancel the translatory directed force of this supraspinatus muscle. So this is our rotatory component of the supraspinatus muscle. So here while rotation, it is also acting like a itis muscle. It will create rotation. At the same time, see the force how it is acting. It is going to pull the head of the humerus towards the scapula, so that it is giving a kind of compression. Is nothing but it is providing stability. At the same time, rotation will happen. This is about the supraspinatus. Last point, that is the long head of the biceps brachii. It has the minimum role while providing dynamic stabilization to the glenohumeral joint. Suppose if we take, this is our scapula, so here we are having the head of the humerus. So in this head of the humerus, we know that name long head of biceps brachii. Long head, here especially they are saying about the long head. It will come to the superior glenoid. From here long head will come, it will come like this. Long head of the biceps will come like this. Okay, this is the long head of the biceps brachii tendon. So here one ligament will be there. Here one ligament will be there. That ligament is the transverse humeral ligament. Okay, leave about this ligament. Here what is the point means, so the tendon which is originating from the superior glenoid, see here superior glenoid force like that we can tell. So superior glenoid. So here if we take joint capsule, the tendon which is coming from here, it will cross the joint capsule also. So that what's the point here means, when the biceps is acting, what is the action here? Elbow and shoulder flexion. Biceps will be helpful in the elbow and shoulder flexion. When the shoulder is doing flexion movement, the long head of biceps brachii, which is present here like this, it is going to pull the head of the humerus into the glenoid cavity. It is going to the action, it will be like this. So head of the humerus is going to pull into the or towards the glenoid fossa. So while producing this kind of forces inside the joint, the long head of biceps brachii also involved in the dynamic stabilization of the shoulder joint. Now we'll see all together once. If we take deltoid, so deltoid force will be, like this. So here we'll get one translatory force and then one rotatory force. After that, itis muscles. If we take itis muscles, so here force will be in this direction. So here we will get one rotatory force and then one translatory force. After that, if we take supraspinatus muscle, so here force will be in this direction. Supraspinatus force will be in this direction. So here we will get one translatory force, rotatory force, and here we will get one translatory force. So here in this deltoid muscle, the translatory force is more, so that it is going to create superior translation of the head of the humerus. It should be balanced, even though it is creating rotation. Rotation magnitude is less, translation magnitude is more. So it should be balanced by the some force. That force will be come through the itis, infraspinatus, teres minor and subscapularis. So here fx component, it will come here, so that here fx component, so these two forces cancel each other, resultant will be 0, so that there is no superior translation will happen. How it is not happening? Because of the action of the itis muscle. So that means these two will work together to produce the dynamic stabilization. Now we will come to this point. So this force cancel, it is coming here. So here remaining force only rotatory force, here rotation will happen. Here also if this force goes to this direction, here only this rotation force is there. So this force will create rotation moment at the same time. At the same time, here if we take scapula, so the force which is acting in this direction, it is going to pull the head of the humerus to the glenoid cavity, so that it is providing stability at the same time mobility. That is what dynamic. Now if we come to supraspinatus, so here this is our scapula, this is our head of the humerus, So here the direction of force will be in this direction, So here this is the rotatory component, this is the translatory component, rotatory component. So here again same like delta, this translatory component, here one translatory component is there, it was balanced by this translatory force. Here again one translatory force came when supraspinatus muscle is acting. So this translatory force will be cancelled by the gravity, resultant will be 0, so that there is no translation. After that, here remaining force which is there, rotatory force, so it is going to create the pure rotation, abduction movement will happen. At the same time, here also same, this rotatory force is going to pull the head of the humerus into the glenoid cavity, so that it is going to provide rotation plus stabilization. Clear? Now if we come to the long head of biceps brachii, it is a minimal role. Here head of the humerus will be there, here glenoid cavity will be there, so the long head will come from the superior glenoid fossa. From here it will come, here transverse humeral ligament will be there, through this bicipital groove, this tendon will come like this, then muscle will start here, So here while coming down, it is going to cross the joint capsule also. When the movement is happening, either flexion of the shoulder joint, the tendon which is present here, it is going to pull the head of the humerus towards the glenoid cavity, This is how the stability will be provided by the long head of biceps brachii. This is about dynamic stabilization of the shoulder joint. Clear?